Have you ever wondered why some of the most brilliant doctors and nurses, I mean total experts in their field, sometimes struggle when they step into a leadership role? It's a super important question because the stakes are incredibly high for both patient care and the well-being of the staff. So today, let's unpack the really unique challenges of leading in healthcare.
Okay, get this. According to Dr. Don Berwick, it takes 2 full years to replace just one physician leader. That's 2 years of chaos, of cost, of lost momentum. It just goes to show you, the price of getting leadership wrong in this field is absolutely massive.
So what is it? What makes this environment so uniquely tough for leaders to thrive in? Well, it's a mix of things, really. And it all starts the very moment a fantastic clinician gets that promotion.
And here it is, the first major hurdle, that huge leap you have to make from being the go-to expert with all the answers to being the leader who helps their team find the answers. It's a total change in perspective.
And this is where it gets really tricky. The technical skills that made you a star, the very things that got you promoted, they are not the same skills that will make you a great leader. Your whole focus has to shift from what you can do to what you can get done through other people. This whole shift is really about understanding power. Now, the most basic kind is what we call role power. That's just the authority that comes with your job title. Sure, you can assign tasks, but honestly, relying on just that, it's like trying to drive a car with only a steering wheel. You're not going to get very far. Then you've got expertise power. This is where most new leaders in healthcare start out. It's the respect you get for being an amazing clinician. But here's the catch. Your team is the one that gives you this power. And it's still all about your knowledge, not theirs.
And that brings us to the holy grail, relationship power. This is influence that's born from pure trust. It's when your team goes the extra mile, not because they have to, but because they believe in you. And the best part? This is the one kind of power you have the most control over building.
So, if you take one thing away from this section, let it be this. Your value as a leader isn't measured by your own brilliance anymore. It's measured by your ability to unlock the brilliance in your team.
Okay, so you're in the leadership seat. How do you actually motivate your team? Well, it turns out a lot of healthcare systems get this part fundamentally wrong. This analogy just nails it. So many organizations treat their staff like a golf team, rewarding individual star players. But a hospital, a clinic, that's a baseball team. Everybody's success depends on everybody else. When you only reward individuals, you can actually break that teamwork that's so vital. And this quote from Fred Lee really drives the point home. Think about it. Disney gets it. They know that in a high-stakes service environment, you need collaboration, not competition. Pitting your team members against each other for a bonus, that totally undermines the real goal, which is seamless patient care. All right, let's talk about something tough. New leaders, especially when they're promoted from within their own team, often walk right into a wall of resistance and drama from their former peers. It's a really tough spot to be in. Management expert Cy Wakeman puts it bluntly. The #1 mistake leaders make is just avoiding the problem. Crossing your fingers and hoping that difficult person will just quit? That's not a strategy. You have to deal with these behaviors head on.
So how do you actually do that without it blowing up? Well, this framework here gives you a clear path. These questions are brilliant because they put the responsibility back on the employee to think about their own actions. It shifts the whole conversation away from you accusing them to the two of you solving a problem together.
Now we get to the real heart of it all, motivation. So, beyond fixing bad reward systems and handling drama, what's the secret sauce to truly inspiring a team? I'll give you a hint. It goes way, way beyond a paycheck. Just think for a second about how most leaders talk. They usually start with the what. We need to reduce patient wait times, or we provide top-tier cardiac care. It's fine, it's descriptive, but it doesn't exactly light a fire in anyone, does it?
So the slightly better leaders, they move on to how. They'll explain their unique process or their fancy new technology. We use this new scheduling system that reduces wait times. Okay, that's a little more informative, but it's still missing that deeper emotional pull. And this is where the genius of Simon Sinek comes in. He pointed out that the most inspiring leaders, the ones we'd follow anywhere, they don't start with what or how, they start with why. The purpose, the cause, the belief that gets them out of bed in the morning. So what do? You flip the whole script.
You start with why, your purpose. Then you explain how you'll achieve it, and only then do you show what you do as proof. People who work in healthcare are driven by a mission. If you can connect to that mission, that's the real key to motivation.
So we've diagnosed all these different challenges, from mindset shifts to motivation. So what's the prescription? How do we create better leaders in healthcare?
The research on this is crystal clear. Leaders are made, they are not born. The answer isn't to go on a quest to find some natural-born leader. It's to recognize that leadership is a set of skills. Skills that can be taught, that can be learned, and that can be developed in your people. And look, this isn't just some nice idea. There are organizations like Korn Ferry that use billions, with a B, of data points to scientifically figure out what these leadership skills are and how to develop them. The data proves that this skill-based approach really works.
And that brings us right back to where we started. The journey from being a great clinician to being a great leader is not automatic. It is a total transformation. It requires learning a completely new set of skills. Skills like influence, motivation, and inspiration. The skills you need to succeed through others.
So I want to leave you with this one question to think about. When you need to get something done with your team, what do you reach for? Is it your title? Is it your technical expertise? Or is it the trust and the relationships you've built? The answer to that question, well, it reveals everything about your leadership.